their own little way and who have issues in reaching their potential in some way or the other. I do like to see that each child reaches his or her own potential in their own way, depending on what they have and depending on what they don't have. So how do I do it? I use techniques which are called as neurodevelopmental therapy, sensory integration therapy. We also have a basis of connections and attachment, which essentially deals with the psychology of the parents. And of course, we use a lot of instruments, equipments in the department which you can see behind me. These are just a few, but yes, what we essentially need is a skill a therapist has with her hands and the ability to look at the child in a different way and to see how he can perform well in any given environment. We deal with children who have problems in walking, children who have problems in essentially doing any function with their hands. It may be something from buttoning, it may be something to do with writing, a writing skill, or copying down from the board. They may have problems in sitting in one place. Some children may not look at you eye to eye, they may just not give you an eye contact, they may not speak. They may be fidgety, they may just be playing with their own hands. They may be in a world of their own. They may repeat their actions which are just one after another. They may keep playing in a certain way. They may have frequent falls. They may be very irritable, very cranky, not wanting to eat. So these are kids who require help in some way or the other. There are kids who may come to us with just their feet being flat. They may not be able to climb up surfaces like pavements or the roads, may require help in doing so. There are some kids who may not be able to play with other children as effectively as those children are doing, like essentially catching a ball, throwing a ball, kicking a ball. These are functions or play. A play is natural for any child. Our children cannot play the way other children play. So essentially when play is affected, their occupation is affected. For us, our occupation may be working, it may be going to office. For a college student, it may be going to college and looking at or studying lectures. But for a kid, essentially the main function or the main occupation is playing with friends, going to school. If these are the functions which are affected, they cannot participate with their other friends, and essentially that's where the parents come to us concerned that my child is not participating with nature. So parents who come to us essentially are with complaints of delay in milestones. To tag a few conditions, which are the conditions essentially with names with which the parents come to us. It could be autism, it could be attention deficit hyperactive disorders, it could be cerebral palsy, it could be torticollis, to name a musculoskeletal condition where the child's neck is in one direction. It could be weakness of one side of the body, weakness of both the lower extremities, that is the legs. It could be anything to do with the body, it could be anything to do with the mind, it could be a combination of the mind and the body. It could be a sensory processing disorder wherein I can see, I can hear, but I cannot give back what I'm hearing or I am seeing in an effective way to the task which is at my hand. It may be a simple task like drinking water, it may be a simple task like picking up a toy. If I'm not able to do this, or if I'm not able to listen to my teacher in the classroom and focus my attention on what's going on in the class, this is something which is to do with a sensory processing disorder. So sensory processing disorders form a major chunk of the kids who are coming to us. We also have something which is called as a developmental coordination disorder, in which the child cannot at all perform with both sides of the body at one go. Something like a jumping jack, something like jumping from a surface down, something like running. They are very clumsy, they are very spacey, or they may be extremely hyperactive, coming into a room like a bull in a china shop, not controlling their movements in the way other kids do. When can these problems be seen? I as a therapist can notice or can assess a child right from the NICU, right from when the child is born. Now, who are the kids who are at risk and need to come to us when they are newborn? Essentially kids who have had a history of prematurity, who are low birth weight, in whose case the mother has had issues. So these are kids who are at high risk, or they are so-called the NICU graduates, and they definitely require an assessment from our side to ascertain that everything is falling into place and not going into a direction or a deviation of atypical development. What are the problems the parents notice? Problem basically they notice is when the child does not move, when he does not crawl, when he does not sit, and they sometimes tend to keep waiting. Grandparents keep on saying that, okay, the child will walk, just keep on waiting. But when there is a delay, the rule is please approach a pediatric therapist to know the cause of the delay and do something about it. Just don't keep sitting at home saying, okay, my child will be fine. So any sort of delay noticed at any given period of time, maybe 6 months, 8 months, even before that, your child is not smiling at you, not giving you eye contact, immediately come to us and seek help, because a timely help and early help is what your child needs, so that we can take care of the problem early and not wait till the child's brain development, which is at the highest in the first 2 years of life, is sort of shut, because the brain development in the first 2 years encompasses everything. It can have, the child can reach his complete potential if he is intervened early. So early intervention is a rule. After first year of life, if the child is not walking well, if he is falling when he is walking, or essentially not able to play with the other kids, that is a time when you will seek help. When the child reaches 2 years of age and he tends to go to play school, and you see he is not able to hold the crayon, or he is holding the crayon and just scribbling and letting off the crayon go. When he goes to school, he is not able to sit with the other children. If he looks at the board, he is not able to concentrate and be one with what the teacher is saying. So these are the kids who will need help from our side. Going to a little older stage, maybe at 5 years or 6 years, if you see that your child is not able to run, not able to walk, not able to jump, not able to hop, catch, throw, or stand on one leg, these are children who will require help from our side. It could be any problem. It could be the problem to do with the muscles. Problem can be in the nerves or in the systems like the eyes, the ears, or in the skin. Any sort of organ which is receiving information from the environment, the processing can go wrong and the child may require help from our side. The ASCC, or the Artemis Special Children's Center, essentially was developed or came into existence around 2 years ago. Professionals from different fields, essentially the mentor being Dr. Sanjay Swarup. He was the one who pushed forward the entire department and gave it a direction that we need to develop a center for children with musculoskeletal, neurodevelopmental disabilities and multi-sensory issues, where the children can be dealt with a professional team. We have a pediatric neurophysician, we have a developmental pediatrician, we have an pediatric orthopedic surgeon, and we have a team who deals essentially with these issues. We have trained neurodevelopmental therapists, we have sensory integration therapists, we have a clinical psychologist, a speech therapist. On the team in the pipeline, which are going to be the dietitian and the orthotist. So anything to do with pediatric rehabilitation or in the field of rehabilitation of your child is definitely available with us. Do seek our help whenever you feel that your child is delayed. Very early, try to notice any sign which is going away from the normal development. And if you feel you need help, we are here to definitely help you. We will see that we can do our best to help you and to help your child reach his ability to